is Kumobos and welcome to Huli Show. Let's welcome our guest, a specialist from America. A nurse from China. And a teacher from Philippines. For you in the Philippines, what comes in your mind when you hear the word drugs?
Medicina like paracetamol.
For you from China, what comes in your mind when you hear the word drugs?
Mga daot, like marijuana, sigarilyo, o one farm.
For you from America, what comes in your mind when you hear the word drugs?
Mga daot na tambang. Mga bawal na din.
Okay, thank you. So, when we talk drugs, is any chemical substance that causes a change in an organism's psychology or physiology when consumed. Drugs are typically distinguished from food and substance that provide nutritional support. There are classifications of drugs. First is inhalants. Inhalants is a drug volatile substance that produce chemical vapors that can be inhaled to induce psychoactive or mind-alternating effects. There are straight names of inhalants are air blast, mold, chroming, discorama, glad, tipi, crack, moon gaze, etc. The long terms of this are muscle weakness, disorientation, lack of coordination, irritability, depression, serious and sometimes irreversible, damage to the liver, kidneys, lungs, and brain, memory impairment, diminished intelligence, hearing loss, bone marrow damage, death from heart failure or asphyxiation. The short-term effects of this are slurred speech, drunk, dizzy, inability to coordinate movement, hallucination, hostility, apathy, impaired judgment, unconsciousness, severe headaches, rashes around the nose and mouth, prolonged sniffing, and death. The forms of this in our household, which are nail polish remover, spray, paint and glue, lighter fluid, hair and deodorant spray, cleaning fluid, whipped cream, canisters, and also we can see in medical or industrial, and they are gasoline, dry cleaning fluid, nitrous oxide, painter cleaner, and a paint remover. The treatment of this drug is detox, which allows chemicals stored in the body to be flushed out. The recovery of this is a therapy and support groups that will overcome with ongoing cognitive behavioral therapy. Hallucinogens is another drug which diverse group of drugs that alter perception, thoughts, and feelings. The forms of this are ahausak, DMT, lysergic acid, diethylamide, or LSD, peyote, or mescaline, and 4-phosphorylose and N-dimethyl-tryptamine or psilocybin. The short term of these are sweating, euphoria, impaired heightened sensory perceptions, distorted sense of time, feelings of detachments, hallucination, relaxation, enhanced sexual feelings, dry mouth, lack of appetite, sleep issues, spiritual awakening, and molecular uncoordinated movements. The long-term effects are persistent psychosis, hallucinogen persisting perception disorder or HPPD, flashbacks, and a motivational syndrome. The street names of this drug is spirit molecule, Gina, herbal, speedball, sugar cubes, blood acid. The treatment of this is rely on vast array therapy options. The recovery of this is the support and therapy. Another drug is narcotics that affects mood and it is non-medical purposes. The street names of these are blow, big rush, girl, slow, and short. The short term of these are relaxation, indifference to emotional, physical pain, drowsiness, constipation, slow breathing, and death. The long terms is highly addictive. The forms of this drug is form B. The treatment if these drugs are naloxone, a narcotic antagonist. The recovery of this drug is detoxification, medication, a narcotic antagonist, assisted therapies, and behavioral therapies. Gateway drugs are forms or they are alcohol, nicotine, and marijuana. The street names of these are candy, downers, sleeping pills, and trunks. The short terms of these are alertness, focus, sleeplessness, loss of appetite, increased blood pressure, and heart rate. Long term of these are addiction, paranoia, insomnia, extreme weight change. Treatment of gateway drugs is supports of groups, detoxification, medication-assisted therapies, and behavioral therapies. The recovery of gateway drugs is counseling, moral support, and medication. Stimulants are form of nicotine, cocaine, ice, betel nut, etc. The street names are rock apple, girl, big rush, etc. The short-term effects are loss of appetite, increased heart rate, blood pressure, etc. Long-term effects are increased blood pressure, chronic insomnia, impotence, seizures, heart failure, etc. Treatments and recovery is to quiet and or counsel. Lastly is depressants drug. Is formed like alcohol, cannabis, ketamine, etc. Street names are black, busters, donors, double trouble, gophers, etc. Long-term effects are addiction, can result withdrawal, can be painful, seizures, and death. Short-term effects are slows normal brain functions and give a drowsy feelings. Treatments are medication and psychotherapy. For recovery is to quiet, just be happy. For you in the Philippines, how widespread do you feel the drug problems in your country?
In the Philippines, we are afraid.
For you in the China, what about in your city, state, neighborhood, and school? How widespread do you feel the drug problem in your country?
For example, sa aming eskwelahan ay nagganito ang hadlok ng malabaan.
How does today's drug use compared to that 10 years ago, 20 years ago, etc.?
Sa una, daghan karon gamay na lang aging
Why do they drug use is so prevalent? What are possible reasons why people begin using drugs?
Dala sa barkada.
Tungod sa may kwarta.
agi sa kahirap.
Once someone is addicted to drugs, what controls the addiction? The user or the drug itself?
Drug itself.
Because, di siya kontrol sa iyang kagalingon.
Tungod sa kataas sa dosis sa tambal nga iyang gigamit.
That would be all for today. Thank you very much for our guests.
Alma Sarse